June is Men's Health Month, and sometimes the men in our lives need a little prompting to remember to schedule their annual checkup. Unity Point clinics have convenient, personalized care options, and they are open and taking appointments. Dr. Nick Mancuso, an internal medicine provider with Unity Point Clinic, joins us today with more. Hello.
Hello, how are you doing today?
Oh, I'm doing well, thank you. How are you? I'm sure very busy.
Yes, but happy to take time for a very important topic, highlighting men's health in June.
Yeah, I think this is such a great topic because I know men, sometimes I have to kind of prod my husband to make sure he makes it to the doctor at least every year. Why is that so important?
Well, very, very important to make sure that you're following up on normal healthcare maintenance, wellness topics, especially in our younger population, our 20s, 30s, 40, 50-year-old men. This is definitely the time of life where bad habits can take root. And it's important to jump on those early. It's really important to establish that relationship with the physician because you need to be comfortable, because there are going to be topics that come up in your life that you may not be very comfortable opening up about, and having that relationship is important. Following up on blood pressure, cholesterol, screening for diabetes, and very importantly, making sure you're following with the doctor for your yearly or every 10-year cancer screenings, depending on the type. Colon cancer is a very important one. Recommendations have currently changed in terms of guidelines on when to start. So making sure you're plugged in with the doctor and getting those individualized healthcare screenings and wellness checks done is very, very important.
Yeah, and you mentioned building a relationship with your provider. I feel like women, we're always looking to build relationships and having like one person to go to. Is that important for men too?
Oh, absolutely. I mean, it's as you touched on, it's important for everyone. Men with healthcare usually don't have to build that relationship. Women are kind of thrust into the situation often with having OB providers and establishing that relationship as they're younger, and it carries on through the decades in life. Men really don't do that. And often in my experience, if they are not proactive in following up with their wellness checks, it usually catches up to them later in life, not by choice. So very important to get that personalized relationship down early so that you can move together in a kind of a mutualistic relationship with your provider.
Yeah, and have that consistency. What are some questions men should be asking? You mentioned the cancer screenings. Anything else we need to stay on top of?
Yes, so making sure you're asking about cancer screenings. Very important ones in men are colon cancer, both men and women, prostate cancer screening, higher low risk individuals opting in and opting out. Skin cancer screening is very important. Making sure you're doing a whole skin check, every 1 to 3 years. And depending on your risk factors, smokers, talking about lung cancer, if you meet certain guidelines, or asking your provider if and when you do meet those guidelines. Other important questions are making sure, if you have an issue, if you have a healthcare concern, that it's brought up, no matter how small it might be, because those might be the first harbingers of a potentially developing illness.
And you mentioned men in their 20s and 30s, so even in the 20s, teens, they need to be going, right? Every year.
Yes, at least once or every couple years, just to make sure we're checking for diabetes, that you've had your cholesterol checked, that we're checking our blood pressure, and that we're monitoring our weight and our healthy habits. And when I talk about healthy habits, I mean substance use such as alcohol, nicotine products, tobacco products, recreational drugs, and sexual health. STD screening is very important in our younger population, and really in our older population too. Something we should be open about and talk about if there's any concerns.
Well, Dr. Mancuso, thank you so much for joining us to talk about Men's Health Month in June. We appreciate it.
Absolutely. It's been my pleasure chatting with you and highlighting a very important topic.
And you can visit Unity Point online at unitypoint.org or follow them on Facebook. The handle is right there on your screen.